Susan East Nelson. I'm the Executive Director of the Louisiana Partnership for Children and Families. And we're here today at our Feeding Children Summit. This summit has been about a year in the making. It was sponsored by the Pew Charitable Trust, and it's a collaboration of several organizations, the Department of Education, the 3 O'Clock Project, folks from Feeding Louisiana and No Kid Hungry Louisiana as well have worked on this effort to really start a dialogue among the folks who feed children, whether that's in the community, whether that's after school, or whether that's in school in the regular K through 12 programs. And so we're here today to talk about strategies, how do we work together, and how do we respond to crisis. You know, COVID has taught us a lot. We've had a lot of issues with COVID and schools closing, but Louisiana is no stranger to disasters. And so, you know, if your school district is not able to feed children because of some sort of disaster or hurricane or a flood or whatever, who are the people you can reach out to and ask for help and get their support in helping maintain your operations and making sure kids are getting fed in difficult times? The theme of today's summit is We Nourish so that they can flourish, because everyone here is gathered to talk about how we feed children better. And not only how we feed children better through the mechanical means, but also what we're feeding children. Is it high nutrition food? Is it food that they want to eat? And having those conversations. Child hunger is very severe in Louisiana. It's estimated that 1 in 4 children, and this was before the pandemic, were food insecure, which meant they didn't know where their next meal was coming from. A lot of children rely on, we have over 500,000 children who are eligible for free and reduced lunch here in Louisiana, and that's just in K through 12. That doesn't even count the number of children in early care settings that are also eligible for free and reduced or free meals through those centers. So child hunger is very severe in Louisiana, and without the normal structures that feed children, children don't eat. We have programs where they send backpacks home with children on Fridays because we know that kids don't have food on Saturday and Sunday when they're at home with their families. So this is really exploring those issues and coming up with ways where we can really marshal all the resources to feed children.
Well, the Department of Education has a major role in that because the department is the state agency that administers the federal child nutrition programs, the school lunch program, the school breakfast program, the summer feeding program, and the program that feeds daycare students or daycare children as well. So we have a critical, vital role in the feeding and the food security of children throughout the state. In the last few years, we have really tried to work with our partners, our statewide partners, on access and on outreach. We want to make sure that people are aware of our programs. Most people who have children in school are aware of the school lunch program. They're aware of the school breakfast program. But we want to make sure that they know about what else is out there, about the summer meals programs. Your child could go to any open site in the state during the summer, as long as they're participating, and receive a meal at no charge. But a lot of people don't know that. We're also doing things like our Farm to School program, where we are trying to encourage school systems to work with local producers, local growers, to bring in fresh produce into the school systems.
I'm talking about connecting students in schools with public benefits outside of the school meal program. So SNAP, WIC, other benefits that are available to kids and families that don't have enough resources from income alone to meet their nutritional needs. We see that Louisiana's children are all too often in very difficult situations. About more than a quarter of Louisiana's children are growing up in poverty. During the pandemic in particular, many Louisiana families have experienced much deeper levels of food insecurity than they have in the past, and many children have gone without enough food or without adequate food. At levels that we simply didn't see before the pandemic. So from where we sit, we're seeing a real crisis for Louisiana's children, and the response from food and nutrition programs is critical to meeting that need. This is a problem facing children throughout Louisiana, whether they live in Louisiana's cities or rural areas. There are very many families who simply don't have access to jobs that pay enough for them to meet all of their needs, or adequate resources to ensure the kind of complete diets that we would wish every child has growing up. The problem is a little bit different in different areas. In rural areas, often transportation is a huge barrier to opportunity. In urban areas, there are many other difficulties that kids and families often face, but in general, the combination of low wages and disinvestment in important programs for Louisiana's kids, including education and otherwise, have left families in a very tight spot.
It is the most serious issue that we have. We are number 2 in the nation. Some of our parishes are number 1 in North America for childhood food insecurity, and it's the most important thing we could be doing for our children, second to educating them. Focus Foods, we're headquartered in Baton Rouge, Louisiana, and we are one of the primary vendors for the Child and Adult Care Feeding Program, which is administered through the USDA and the State Department of Education. So the program fills the need for feeding at-risk and needy children outside of the school hours, so basically supper and snack. And we do that through a meal box, which is delivered to the home, or through pickup sites, which we maintain throughout the state.
My workshop is called Fostering Relationships with Local Farmers, Schools, and Communities. And it's really important because with the obesity levels that we're facing here in Louisiana, we want to make sure that not only are we buying local food, but being able to access that fresh food for our children in the state, and so that they can make healthier choices. And even our program also offers guidance on school gardens and things like that. So we always know that if the kids are growing the food, then they're definitely going to be eating that food that they grow. So it's really important to have those relationships within the community with local farmers, so that the kids are aware of that and they're aware of their agriculture. And so we're just looking to educate on every level, from the schools to the kids to the teachers to the communities. Well, we mainly reach out to small and medium-sized farmers, and we have had a great response from them. They're always looking to add new markets, and so we have a good relationship with several of those farmers, and so if anyone has any type of organization that feeds children, we're always available to help guide you to find those local farmers. If you feel like they're not around you, they are they may not always be visible, but we can always help make those connections through the Louisiana Farm to School program. There's lots of opportunities there, like the farmers can come in and do a visit, and just kind of create some awareness and more knowledge about how food is grown. You just don't go into a grocery store and the food is magically there. The food doesn't come from a grocery store, so the food comes from local farmers, and so we want to promote that, and we want to build up our own economies here in the community, and that's really important. And then not only that, the more kids learn about where their food comes from, the more interested they're going to be, and the better choices that they're going to make.
My name is RORY GRESHAM, and I work for Richland Parish School Systems. I am the grower for their project they had. We grow lettuce, tomatoes, bell peppers, cucumbers, cherry tomatoes for our school cafeterias. We service 11 schools out of greenhouses that are on the school property. It made our kids eat healthier food. They're fresh. We have less stale. It's very good for our kids. It's from a farm to school program. In 1987, these greenhouses were built. They were never really used when we got them. They were run down. There was no tops on them. There was no equipment in them. We built all our equipment on campus and built the whole system back up to run. My advice to other school systems is, come look at our system. It's easier than you think it is. It's very good for the kids. It's very good for the schools.
We could not be more excited about the success. We have a good group of partners, and we have so much enthusiasm for child nutrition and what we do. And we are seeing things like farmers contacting our farm to school program saying, "Hi, how do I get started selling to schools?" We have just recently launched our Louisiana Festival of Flavors grant. It is a grant that we have with USDA, where we are getting school systems around the state and helping them with the process of standardizing a school nutrition recipe. That sounds like a long, boring word, but what that means is we're helping them take a local recipe, a recipe that their students enjoy, and tweaking it and changing it so that it makes sure to meet the nutrition standards that USDA requires. It meets meal pattern standards that the USDA requires, so that they can serve that meal, serve that recipe to their school children, and they are sure that they are going to get their reimbursement from the government, that everything is in order as it should be. So we are hoping to have recipes come out of this grant that not only will be shared across the state, but be shared throughout the nation by USDA.
We know that 1 in 4 kids in Louisiana are hungry. They're not getting enough to eat. But the calories that they are eating is contributing to the child obesity epidemic. We need to work more across policymakers, school districts, and even with families to figure out how can we change the environment for children. We see that the meals they're eating at school actually are quite healthy, and over the school year, children are gaining an appropriate amount of weight. But it's really during the summertime that we see excessive weight gain. So we need to figure out how do we help kids during the summer to continue to eat healthier. So you might wonder, why are we talking about obesity, right? Because the main focus is really childhood hunger. And we know that 1 in 4 kids in Louisiana are not getting sufficient calories. They're going hungry. But the flip side of that is that many of our children are malnourished and they're getting too many calories, but those calories are not nutritious for their bodies, and it's contributing to childhood obesity, which is what I'll talk about today. And so I wanted to share with you the new initiative at Pennington Biomedical, Obesity USA, and I invite you to step into the town of obesity. What is it? It's the fastest growing place in the world, where fast food restaurants outnumber grocery stores 6 to 1. Just let that sink in for a moment. As people are going about their days trying to make food decisions, they have 6 times more fast food restaurants than grocery stores, where 1 out of 3 ads we see on television are for junk food. And that's similar whether you're talking about a movie on Netflix or ads online, on movies online, etc. And where you can have dessert for breakfast, we call it a muffin. So think about the sugar and the calories that we're consuming and the portion sizes and everything. So there's just so much cultural and environmental factor that goes into our daily lives related to obesity. So part of this Obesity USA campaign is to think about the numbers. And so why do we say it's an epidemic that threatens our nation's well-being? Well, some people think in terms of dollars and cents and numbers. So if you think of numbers, 42% of adults in this country suffer from obesity. And so that's 115 million people in our country that are considered having obesity. Alarmingly, the prevalence of severe obesity has doubled in the last 20 years. And that's when you really start to see those health complications from heart disease, from diabetes, from cancer. We see the impact on the labor market. Adults who are working and have obesity tend to miss more days of work because of doctor's visits and illnesses. And children actually miss more days of school, those who have obesity versus those who do not. But change is invaluable, and estimates show that just a 25% reduction in the obesity prevalence would result in enormous healthcare savings, over $92 billion. And we've shown here at Pennington Biomedical through our research, as well as through policies and research elsewhere, that for every dollar invested in obesity prevention, there's a $4 return on investment. All right, so what's going on in the childhood obesity space? Just 20 years ago, and you might actually still hear this today, pediatricians would tell families, look, don't worry if your child carries some extra weight, they'll grow out of it. They're probably not going to have obesity as adults. But if you look at the data, it really does not pan out like that. So about 8 in 10 kids who have obesity as children will continue to have obesity as adults. And we're seeing with the kids I work with here in Baton Rouge and throughout Louisiana that preteens and teens are already developing early signs of heart disease, of diabetes. So these diseases that we thought were middle-aged and older, we're starting to see among our 12, 13, 14-year-old kids. So when we talk about obesity for kids, we use a percentile. And those of you who are parents in the room, or many of you do work with kids, you're probably familiar with the early years looking at length for age percentiles and weight for age percentiles. So it's similar. Once you hit 2 up to year 20, we take the BMI and we plot it on a graph against other kids of the same sex and the same age. And so you can see here on the chart, if you're in the green range of a percentile, that's the 5th to the 85th percentile, the child's considered having a healthy weight. And then 85th to 95th is overweight, and 95th and above is considered having obesity. So if you think about just the general population, if we're using percentiles, really there should be about 5% of kids who are above the 95th or higher percentile. You can think about it like standardized test scores, right? And in fact, that's how it was in the 60s and 70s and 80s. But now, as I'll show you, that's increased to 20% of our kids above the 95th percentile. And these charts have actually been updated to go above, even higher, because we're realizing oftentimes pediatricians use these charts, and kids are off the charts. They're higher than what the chart allows. And one of the problems there is you can't track the kid's growth anymore once they're off the chart. And for the child that is able to start losing weight or slowing their weight down, they're not able to see that on the chart. And so a lot of the electronic medical records that doctors are using have this chart automatically plugged in, and doctors are able to give the parent a handout that shows them with the color coding where their child is. Oftentimes we'll see trends over time. So if that child's going in every year for their well child check, the doctor can start noticing, look, your child's at the 85th percentile, but they're keeping at the 85th percentile. Versus your child's at the 85th percentile last year, now they're at the 90th. Next year, they're at the 95th. So that's a way to kind of start seeing the children who are gaining weight too rapidly. So knowing that, we're looking at kids above the 95th percentile, you can see, when their parents or grandparents were growing up, the obesity prevalence was about 5% or so. And now in recent years, it's gotten to above 20%. And we've especially seen a rapid increase among kids aged 6 to 11 and 12 to 19. Those preschoolers seem to be flattening out a little bit, which is exciting news, but still these rates are about 3 to 4 times higher than they were just a couple of generations ago. We need to continue investing in programs and policies that are going to help prevent and treat childhood obesity. $1 of investment in preventing child obesity is a $4 return on investment. There's a lot we can do in the early childhood space to make sure our kids aren't going to grow up with heart disease and diabetes that are going to end up costing the state a lot more money in the long run.
I was concerned about the number of children in our community in Louisiana who didn't have access to healthy meals after school, so I started the 3 o'clock project. So we deliver healthy dinner or snack directly to students who are in an after-school enrichment program. We hope that it's made a really great one in communities that don't have access to these healthy food. We were seeing after-school programs that maybe had some snacks, unhealthy snacks that were available to the kids. And now that we've partnered up with a lot of these organizations, they are now eating a healthy dinner before they even go home for the day. There's a great discussion about food insecurity and childhood obesity, and I have so much to say on that topic, but people who aren't in this space say, how can we possibly have hungry kids? We have obese kids, right? How does that work? Well, it's what they're eating and what they have access to. And we're going to talk about that in a little bit, but there is such a need also for after-school meal programs. I think that is why we started, right, our nonprofit. We're called 3 o'clock Project, so we serve a meal when the bell rings at 3 o'clock, and a lot of children don't have a meal to go home to. So the food insecurity that we saw with breakfast and lunch has only really driven that line up higher for the need for an after-school healthy meal and a summer healthy meal. We learned that the best way to reach the kids most in need is collaborating. You cannot do this alone. You will not reach all of those who really need your help if it's just you by yourself. And that's what we've kind of really learned well through this and seen the beauty and the silver lining of COVID, and all of these organizations kind of come together and say, no, this is important, and we're going to pause what we're doing because it's really important to feed these kids. And like I said, that was that is something to me that's a positive out of all of this, is seeing how many folks who maybe didn't have this on their radar before, it's now on their radar, and hopefully we can take that momentum and keep going with it.
What is your recommendation for Louisiana?
To expand these programs. You know, this is a federally funded program called the Child and Adult Food Care Program, so I think as many communities that have the need should be participating in this program and feeding kids where there's the need.
Collaboration right now. I think we need to build relationships and get all of the folks together who feed children, whether that's in school through the food and nutrition folks who have really just had a very difficult 2 years, or the community organizations like the 3 O'Clock Project or like Focus Foods who are working to feed the kids after hours, and really get everyone together so that we all work for the same issue of feeding children.
My recommendation is for the state to continue to allow innovative practices in administering all of these programs that the USDA has in place. Since COVID, the entire outlook has changed on how children can and should be fed, and to keep the guardrails in place, but again, to allow innovation where innovation is due.
I want the state to continue with its plan of outreach, to continue with its plan of spreading the news, spreading the information, making these programs accessible to people, especially in the rural locations of our state, to people who don't know what's out there and what resources are available for them. So that, I think, is that's our huge goal right now, is to spread that word and make sure that the people in the rural little districts that don't have as much access know what is out there and what we can do to help.
Well, I think the state needs to invest in its children. We need to have greater investment in education, greater investment in making sure that food assistance programs are accessible and don't require too many hoops for families to jump through in order to make sure that they have resources to keep food on the table.
We need to continue investing in programs and policies that are going to help prevent and treat childhood obesity. $1 of investment in preventing child obesity is a $4 return on investment. There's a lot we can do in the early childhood space to make sure our kids aren't going to grow up with heart disease and diabetes that are going to end up costing the state a lot more money in the long run.
You can visit our website at louisianapartnership.org, and we'll have the full information on the summit and the presentations from the presenters.